Hello, this is Dane Mitchell for International Health. The issue that we are addressing as a group is maternal health in indigenous Bolivia. And the idea that I'm going to present, the part of the project that I'm going to present is the building of healthcare clinics, small preventative healthcare clinics in these indigenous poverty-stricken areas that serve about 5,000 people each and will serve as a vehicle for maternal health care. We recognize that in these areas, many times women do not have adequate access to health care, and we'd like to change that by bringing health care to them, because they do live so very far away from cities and they often don't have a means of transportation. Our idea is to provide a healthcare clinic for them that they can go in and receive preventative health care for free. We have thought a lot about how we're going to finance these, and we came up with several ideas. Ideally, first of all, the ideal situation is that the government will cooperate with the coalition that we have formed and help to sustain and build these healthcare clinics. This would be ideal because Bolivia does have a socialized system of medicine. So it would provide a seamless transition, and we would kind of mesh our idea and our funding with theirs. That way, people can receive the health care that they need from the system that already is in place. Our idea to help the government help us, to get them to help us, would be, there's actually a foundation called the Borgen Project. It was started by a philanthropist in the United States, and it basically works on the political level to advocate for institutional changes in government to help poverty-stricken areas, to raise awareness and to be basically be persuasive and help governments make decisions that will benefit large populations of people. So ideally, we would form a coalition with several other charities, including the Borgen Project, that would help us to advocate and petition the government to help us with this project. And we believe that if we form a large enough coalition, that we will be a little bit more persuasive as well. So if we partner with women's foundations such as Women on Wings, TOSTAN, and Women for Women, in addition to larger charities such as United Way or the Task Force for Global Health, we believe that through this we'll be able to be more persuasive and help the government to help its own people, basically. As far as charging for services, we've thought a little bit about how we're going to make money, or if we're going to make money from the people we're serving. And we thought that initially we want to offer these as free services to people. We recognize that cash flow is important, but we also recognize that culturally these people are not used to using the system that is already in place. They're not used to paying for healthcare, and we think that it would discourage a lot of people from seeking healthcare if they knew they had to pay for it. So that's one of our main goals, is to make this free and accessible to everybody. In the future, we might change that and have kind of a tiered system where those who can afford it can pay a little bit and those who can't still won't pay. But for now, I think we will have it as a free service right now, and we will focus on being sustained by other charities and hopefully by the government as well.
Last video I talked about gaining trust from our target population, the Quechua people, and we would gain their trust by helping our medical staff learn about their culture and their traditions, and allowing the people to freely practice those traditions, birthing traditions, in the hospital to a certain extent. And so in this video I want to talk about what happens after we gain their trust. So after we gain their trust, we want to make sure that we provide them with the most excellent curriculum in prenatal care. And so I was doing some research, and we found this article from the WHO in their website, and it talks about new guidelines on antenatal care, and it's recently new. It's this year that it was published. And so we would like to implement this new guideline in our program and be able to help the people with this guideline. And so this guideline talks about some new recommendations, such as standard maternal and fetal assessments during pregnancy. It talks about nutrition and recommendations. And it also talks about prevention and treatment of physiological problems, such as nausea or heartburn, and any other complications that the women might experience. And it also talks about preventative interventions for certain contexts, which that means it would inform our clients about interventions on certain diseases like malaria or HIV, and especially if it is common in their area. So that is very important for maternal health, as we want to eliminate any risks, additional risks that they don't need to go through. And it's also very important that they receive counseling and support. And during this counseling and support, they would see if they're going through violence with their partners, if their partners are being violent. And then, let's see. Also, the number of contacts that these pregnant women would have would be increased from 4 to 8, meaning the health providers, that's their contacts. And as increasing the number from 4 to 8, doubling the number, then this reduces, studies have shown that this reduces the likelihood of the babies being stillborn. So also in these contacts, they're going to be very frequent, and the first contact that the women would be encouraged to have would be in the first 12 weeks of pregnancy, and then after that it's like 20, then 24 weeks, all along through the pregnancy. And so, in summary, as we implement the new guidelines on antenatal care from the WHO, we will be able to provide that quality service that we want for our target population, the Quechua people, well, Quechua women that are pregnant. And yeah, in summary, that is what the curriculum has. It has counseling in diet, physical activity, other things that I didn't mention but that are also part of our tobacco and substance use, malaria and HIV prevention, blood tests and tetanus vaccination, and fetal measurement. And they would also help with nausea, back pain, and constipation that happen during.
Hi, this is Chad Bowman, and I am addressing a question from Brother Meacham about IMCI, or Integrated Management of Childhood Illnesses. I looked into it, and Bolivia is already a part of this program, so it would pair well with what we're doing with the clinics. And in particular, there's was a study done by Ronald Gutierrez, where in 1999, where they studied community-based IMCI, and it was found to be much more effective when paired with the clinical IMCI. So I think that would be a good way to go for our program. Also, I would suggest pairing with Gap Medics. They have a program where they have midwife internships internationally, and so that would be an outlet for bringing in people to help with midwifery and helping to get them out to the communities for those who couldn't travel to the clinics. Thank you.
The maternal health program in Bolivia will be rolled out in 3 phases. Phase 1, education classes. The first class emphasizes introducing the volunteers, doctors, nurses, and the purpose of the clinic. The doctors and nurses that will be brought into the country will immerse themselves into the community. They will be learning the culture, they'll be learning the people, and they'll hopefully be gaining the trust of the people. Once that first lesson has been started, we'll roll out phase 2, the building of the clinic. We're going to ask for community members to help build so that they have a sense of ownership, that they will feel comfortable with coming to the clinic since they were a part of it, a part of building it. Once the clinic is up and running and is doing well, we will implement phase 3, the midwife certification courses. These courses will hopefully bring more medical training to the community. Once the third phase has been successfully introduced, the clinic will be a full functioning center for education, certification, and to receive maternal and neonatal medical intervention. Thank you.